Asia. It is a pivot for Thailand to hold this meeting this year. The COVID-19 pandemic prevents us all from meeting in person. With the virtual meeting, we can still maintain our solidarity and the importance of the regional committee to provide direction for health-related matters of the region, particularly on the response to COVID-19 pandemic and maintaining essential health services. I would like to take this opportunity to express my thanks and appreciation to the regional and country office for providing Thailand efforts in ensuring effective virtual meeting. I wish you all successful deliberation and enjoying the new experience of this virtual regional meeting.
Thank you, thank you, Dr. Supakit, for your welcome address. Next will be a video statement by the chair of the TFRC, His Excellency Dr. Vardhan, Minister of Health and Family Welfare, Science and Technology, and Earth Sciences, Government of India. Please, Excellency.
Your Excellency, Honorable Prime Minister, Deputy Prime Minister and Minister of Health, Thailand. Excellencies, Ministers of Health from WHO Southeast Asia region, WHO Director General Dr. Offer my deepest condolences at the loss of lives across the region due to COVID-19. On behalf of member states of Southeast Asia region, let me extend my heartfelt gratitude to our brave frontline workers whose collective efforts at the cost of their own safety and well-being have not only helped save lives, but have also shown us resoluteness in caring for all in the face of adversity. I salute them all. The pandemic has made us to redefine the means of a meeting or interaction. Although it would have been a pleasure to meet with you all in person in beautiful and hospitable Thailand for our annual interchange of ideas and insights into the regional health issues, benefiting from the interactions with public health leaders, experts, and partners. We are thankful for the efforts of the Ministry of Public Health Thailand and the Secretariat in organizing this virtual RC73 session. I take this opportunity to extend a very warm welcome to all of you to the inaugural program of the 73rd session of the WHO Southeast Asia Regional Committee. The Regional Committee platform is indeed very useful, not only for highlighting the advancements made as a result of all our collective efforts, but also in discussing some of the most pressing regional and global public health issues and the way forward. Despite challenging circumstances, our common goal of health for all unites us all, even from thousands of miles away. And this very goal will drive our discourse on regional health issues today. And I genuinely look forward to the day when we can all meet each other physically and safely, and possibly sometimes in the near future, so that we can take our agenda forward and share our learnings with each other. Southeast Asia region, with its 11 member states, represents a quarter of the world's population. Therefore, strengthening the healthcare systems of the member states of the region and monitoring and sustaining the outcomes achieved across all levels will not only be key to achieving both the $3 billion target and sustainable development goals, but will also have long-term implications for improving the state of the global health. Excellencies, this unprecedented pandemic has significantly impacted our healthcare systems as well as the people. As we continue to lead the war against COVID-19 effectively in the region, sharing of the best practices through such important virtual platforms helps us to learn from each other and to further improve our healthcare systems and response. The challenges faced by member states of WHO Southeast Asia region today as a result of the ongoing health and economic crisis demand strong collaborative partnerships and a collective responsibility to act in order to mitigate the risks imposed by the pandemic. I look forward to the deliberations in the ministerial roundtable and the useful people-friendly outcomes of this regional committee session. Lastly, I take this opportunity to express my support to colleague health ministers and member states of WHO Southeast Asia region. Your Excellency Anutin Chandrakul, Deputy Prime Minister and Minister of Health Thailand, Excellencies Ministers of Health from WHO Southeast Asia region, WHO Director General Dr. Tedros, Regional Director Dr. Poonam Khetrapal Singh, distinguished representatives from member states, ambassadors, representatives of United Nations agencies, development partners, non-governmental.
Thank you, Excellency, for your statement. Next will be a video statement by Dr. Tedros Ghebreyesus, Director General of the World Health Organization. Please, ka.
Your Excellency, Mr. Anutin Charnvirakul, Deputy Prime Minister and Minister of Public Health of Thailand, Your Excellency, Dr. Harsh Vardhan, Minister of Health and Family Welfare of India, and Chair of the 72nd Regional Committee and Chair of the Executive Board of WHO, Dr. Jedsada Jokdamorongusk, Permanent Secretary of the Ministry of Public Health of Thailand, Honorable Ministers and Heads of Delegation, Regional Director, my sister Dr. Poonam Singh, dear colleagues and friends, Sawadee Krap. I would like to thank Thailand for hosting the SEAR's Regional Committee, albeit virtually. 12 months ago, Ebola robbed me of the opportunity of being with you in person. This year, COVID-19 has deprived all of us of meeting together. As you know, the virus has taken so much from us. Your region is now the second most affected globally, with almost 5 million reported cases and more than 220,000 deaths. I offer my deepest condolences to those who have lost someone they love. I offer my sincere thanks and admiration for your health workers who are working tirelessly to save lives. And I offer WHO's steadfast commitment to work with you to defeat the outbreak. It's very important to remember that no matter the situation, it can be turned around. It's never too late. In the coming months, we hope to have good news about vaccines for COVID-19. WHO is working hard with our partners to ensure that once vaccines are available, they're available to all countries on an equitable basis. We thank those countries that have joined the COVAX facility, and we urge those that haven't to join by the 18th of September. But we do not need to wait for a vaccine. There are steps all countries can take now to suppress transmission and save lives. Stay-at-home orders and other restrictions are blunt instruments that have taken a heavy social and economic toll. WHO is committed to supporting all countries to reopen their societies, economies, and borders, and to do it safely. We urge all countries to focus on 4 priorities. First, prevent amplifying events. Second, save lives by protecting the vulnerable. Third, empower and educate people and communities to protect themselves and others. And fourth, focus on the public health basics. Find, isolate, test and care for cases, and trace and quarantine their cases. Countries that do these 4 things and do them well can reopen safely. Those that reopen without paying attention to these 4 priorities do so at their peril. The pandemic is teaching all of us some painful but valuable lessons, that in our interconnected world, no country is immune. Even the world's biggest economies and most advanced health systems were caught by surprise. There is no question that the pandemic will set us back in our efforts to achieve the 3 billion targets and the Sustainable Development Goals. But far from giving up, the pandemic must drive us to work towards those targets with renewed determination. More than ever, we have seen the value of universal health coverage, the value of investing in global health security, and the value of breathing clean air. History will judge us on the actions we took to end the pandemic, but it will also judge us on the lessons we learned and the actions we took to build back better. Thank you all for your support and for your commitment. WHO is committed to working with all of you to promote health, keep the world safe, and serve the vulnerable. I look forward to seeing you next year, hopefully in person. Thank you very much. Khop kun krab.
Thank you, Dr. Tedros, for your statement. Now I have the honor to invite Dr. Poonam Khetapal Singh, Regional Director of the WHO Southeast Asia region, to deliver a statement. Please, Madam Adi.
Your Excellency, Anutin Charnavirakul, Deputy Prime Minister and Minister of Health, Thailand, Dr. Tedros, Director General WHO, Honorable Ministers of Health from the countries of the WHO Southeast Asia region, colleagues from the international community and from across WHO, distinguished delegates, ladies and gentlemen. It is a pleasure to add my warm welcome to this 73rd session of the Regional Committee for the WHO Southeast Asia region, the first ever regional committee to be held online. My sincere gratitude to our hosts, the Royal Thai government, for their commitment and drive to make this happen. For more than 9 months now, WHO and its member states in the region have acted with speed, scale, and solidarity to respond to the COVID-19 crisis, a crisis that has affected all of humanity and which has impacted social and economic life like no event in living memory. The hard work and determination that your excellencies have demonstrated has saved countless lives. Your ongoing commitment will save many more. Throughout the response and into the recovery and beyond, you can be certain of WHO's unrelenting support. As a region, we must continue to draw on the solidarity and cooperation that has defined our work for many years now and which has been central to the response thus far. Chair, Excellencies, our hosts, Thailand, are a regional and global leader in health security. Thailand was the first country in the world outside of China to detect and report a case of COVID-19 on the 13th of January. Thailand is proof that a new normal in which low or no transmission occurs can be achieved using basic public health measures. Thailand has shown the benefits of strong health service delivery at all levels, which has been achieved through its ongoing pursuit of universal health coverage, an observation well noted by the WHO-supported COVID-19 Health System Response Monitor. Thailand's sustained efforts to strengthen health security and achieve compliance with the international health regulations have demonstrated results. As expressed in last year's Delhi Declaration on Emergency Preparedness, no country is safe until we all are safe. Investing in public health not only achieves better health outcomes, but also promotes sustainable development and a more equitable and just society. At 15% of public expenditure, Thailand's health spending is above the global average. Our congratulations to the Thai leadership for this far-reaching decision. Across the region, recent increases in health spending have facilitated a range of public health achievements and strengthened health systems coverage and resilience. Throughout the response and into the recovery and beyond, we must secure the allocations required to stay on course and achieve our sustain, accelerate, innovate vision, which contributes to WHO's triple billion targets and advances progress towards sustainable development goals. Chair, Excellencies, history is ours to make, and the future is ours to define. Together, let us grasp this opportunity. Thank you.
Thank you, Madam Adi, for your statement. Now, I have the privilege to invite His Excellency Mr. Anutin Charnvirakul, Deputy Prime Minister and Minister of Public Health, Thailand, to address the 73rd session of the WHO Regional Committee for Southeast Asia. Your Excellency, please.
Excellencies, Dr. Tedros, Dr. Poonam, ladies and gentlemen, greetings from Bangkok and good morning. We expect to host this regional committee meeting in our beautiful Chiang Rai province up in the north of Thailand. However, the COVID-19 pandemic has disappointed us all. We confirm our commitment to host the next regional committee meeting in our home not long from now. As for now, allow me to take the rain check for all of you, and we will definitely meet at our home in the near future. The COVID-19 reminds us of the word crisis, which has still an opportunity. We must collectively avoid and fight the dangers in parallel to looking at many opportunities during the crisis. Never before that we see the strong solidarity of all sectors to fight the health challenge. Never before that health has been at the top of the national priority. Finally, our capacity to prevent, response, and mitigate the pandemic becomes stronger and stronger. These are the great opportunities and assets that we in the public health sector must sustain well beyond COVID-19 pandemic. We must continue our commitment to put the public interest as first priority in order to sustain the public trust from our dedicated works in this crisis. Excellencies, distinguished guests, ladies and gentlemen, Thailand's long-term investment in health systems and universal health coverage has paid off. All COVID-19 patients have universal access to essential health services, including all related services, without financial barrier. However, the war against this virus is still far from conclusion. So we must always keep our guards high in parallel to gradually and carefully opening up the economy for the livelihood of the people. Thailand will spend at any cost, at any project to combat this COVID virus in due course. I would like to congratulate the World Health Organization for its leadership in initiating the global mechanisms for rapid and equitable access to essential new technologies to save lives. The access to COVID-19 tools or ACT accelerators, it has created strong global solidarity. Thailand welcomes and commits and will join in all the ACT accelerators. With that, I wish this regional committee meeting a success and hope to see all of you wherever at our earliest next opportunity. Thank you very much. สวัสดีครับ
Thank you, Excellency. Thank you, Excellency, for your warm and inspiring address. Next will be the Thai cultural performance that we proudly present it to you. It will present you Thai Khon or a Thai mask dance and the Thai culture in all regions of Thailand. Please enjoy. you,ค่ะ. We hope you enjoy the video. Next will be the group photo via Zoom. May I request every member state turn on your camera and then focus to your Honorable Minister and also the head of delegates. Please, Excellency, please join us the group photo through the Zoom. Your smile will count and will be in our memory. Please prepare well,ค่ะ. Smile ค่ะ 1, 2, 3. One more. 1, 2, 3. Smile. Thank you ค่ะ Thank you very much ค่ะ We now move to agenda item number 1, opening the session. May I invite His Excellency Dr. Vardhan, Honorable Minister of Health and Family Welfare, Science and Technology and Earth Sciences, Government of India, for the agenda item number 1, opening the session. Please, Excellency.
Excellencies, Ministers of Health, WHO Director General Dr. Tedros, Regional Director Dr. Poonam Khetpal Singh, distinguished representatives from member states of WHO Southeast Asia region, ambassadors, representatives of United Nations agencies, development partners, non-governmental organizations, academic institutions, philanthropic foundations, ladies and gentlemen, Excellencies and distinguished representatives, as chair of the 72nd session of the WHO Regional Committee for Southeast Asia, I declare the 73rd session of the WHO Regional Committee for Southeast Asia open. It is my pleasure to extend a warm welcome to all of you to the 73rd session of the WHO Regional Committee for Southeast Asia. As you are all aware, this is the first ever regional committee session which is being held virtually due to the extraordinary circumstances created by the global COVID-19 pandemic. Here, I would like to thank the Royal Thai government and His Excellency Mr. Anutin Charnvirakul, Honorable Deputy Prime Minister and Health Minister of the for Public Health for their understanding and complete cooperation, which has made the virtual conduct of this RC 73 session possible. From the very beginning, Honorable Deputy Prime Minister and Minister of Public Health personally and the Ministry of Public Health, Royal Thai government have shown extraordinary leadership in not only contributing and combating the pandemic, but also swiftly adjusting to the new normal and arranging the virtual regional committee session to ensure continuity of businesses and governance in WHO Southeast Asia region. Distinguished delegates, it was very important to hold the regional committee session since this annual general body edition of the region, which has helped the member states in bringing forward and addressing important public health issues of our region and respective countries. It is also a forum which enhances collaboration amongst countries of the region enabling us to respond to emergent public health challenges in a more effective manner. I also take this opportunity to thank the Regional Director, Dr. Poonam Khetapal Singh, for her strong leadership and continuous support to member states right from the very beginning of the outbreak. We are all aware that the emphasis placed by her on collective regional flagship priorities and country-level action has seen this region continue essential health services and achieve many recent successes despite the strain imposed by the pandemic response. I am sure that WHO will continue to strengthen collaborative programs in countries of the region and provide necessary technical assistance to improve public health, especially in the regional flagship areas, including emergency risk management. Distinguished representatives, WHO's technical support in the countries of the region have made an immense contribution towards the response to the COVID-19 pandemic and also in continuing the essential health services. I am sure we all appreciate the work of the regional director and her team. As you are aware, our discussions will span two half-day sessions between 11 a.m. to 3 p.m. Bangkok time today and tomorrow. The provisional agenda for the virtual session of the regional committee includes several items, including discussions under agenda item 5, key addresses and report of the work of WHO, and the agenda item 6, ministerial roundtable on COVID-19. Before we start the proceedings, I hand over the floor to the Secretariat to make administrative announcements, if any.
Excellencies and distinguished delegates, SEARO Secretariat welcomes you to the 73rd session of the Regional Committee. As you are all aware, this virtual session is planned to be held for 2 consecutive half days, today and tomorrow. We thank you and your teams for your valuable time and for the collaboration and coordination to enable us to harness the information technology to conduct this session in these unprecedented times. I would like to point out that we followed an extensive registration process where all registered delegates and participants received the web link to the Regional Committee session following the verification of the registration. Thank you.
Thank you. Excellencies, distinguished representatives, let us now take up the agenda item 2, that is the election of the office bearers. First, let us elect the chairperson. The distinguished representatives are invited to propose the chairperson for the 73rd session of the WHO Regional Committee for Southeast Asia. I give the floor to Her Excellency Ms. Dachen Wangmo, Honorable Minister of Health, Royal Government of Bhutan.
Your Excellencies, honorable delegates, I have the pleasure of proposing His Excellency Mr. Anutin Chakravikul, Honorable Deputy Prime Minister and Minister of Public Health, Royal Thai Government, to be the chairperson of the 73rd session of the Regional Committee for Southeast Asia.
Thank you, Excellency. The name of His Excellency Mr. Anupem Chan Virakul, Honorable Deputy Prime Minister and Minister of Public Health, Royal Thai Government has been proposed as chairperson for the 73rd session of the Regional Committee by the Royal Government of Bhutan as chairperson for the 73rd session of the WHO Regional Committee for Southeast Asia. Any observations from anybody? Now I give the floor to Government of the Republic of Indonesia.
Thank you. Madam Regional Director, Excellency, Ministers of Health, distinguished delegates, ladies and gentlemen. First of all, I, on behalf of the Minister of Health of the Republic of Indonesia, would like to apologize for His Excellency's absence today's meeting due to the urgent meeting with the President. In this regard, I have the pleasure to seconding the proposal for His Excellency, Mr. Anutin Chan Virakul, Honorable Deputy Prime Minister and the Minister of Public Health, Royal Thai Government, to be the chairperson of the 73rd session of the Regional Committee for Southeast Asia. Thank you, Kap Kun Kap.
Thank you. Thank you for seconding the proposal, Republic of Indonesia. Are there any further observations? In view of the fact that there are none, it is my pleasure to announce that His Excellency Mr. A. Nutuin Chan Virakul, Honorable Deputy Prime Minister and Minister of Public Health, Royal Thai Government, is unanimously elected as the chairperson for the 73rd session of the WHO Regional Committee for Southeast Asia. I thank you all for your cooperation and support. May I now call upon His Excellency Mr. Anutin Chan Virakul, Honorable Deputy Prime Minister and Minister of Public Health, Royal Thai Government, to please take the chair and conduct the proceedings as chairperson for the 73rd session of the WHO Regional Committee for Southeast Asia.
Excellency Dr. Harsh Vardhan, Minister of Health and Family Welfare, Science and Technology, and Earth Sciences, Government of India. May I first express my sincere appreciation and gratitude under your leadership that you have led this RC throughout the year. And I will surely concur to your leadership and will bring along and move forward with the policy that you have laid since you took over the chairmanship of this committee. I will carry on your task and your policy with respect and appreciation. Excellency Wang Mo, the Honorable Minister of Health of Bhutan, please accept my utmost gratitude and thanks for proposing my name to be the chairman of this committee. And may I express my gratitude to His Excellency Putranto, the Honorable Minister of Health of Indonesia, for his kind endorsement through the Secretary General of Health Ministry of Indonesia. Excellencies, Ministers of Health, Dr. Tedros, the WHO Director General, Dr. Poonam, Regional Director of WHO Southeast Asia, distinguished guests, representatives from member states of WHO Southeast Asia region, ambassadors, distinguished guests, ladies and gentlemen. First and foremost, I would like to express my sincere gratitude to all distinguished representatives for electing me as chairperson of the 73rd session of WHO Regional Committee for the Southeast Asia. It is indeed a privilege for me personally and for the Royal Thai government, and I'm thankful to all the member states for their support and trust. We were looking forward to host all of you with traditional Thai hospitality in this beautiful country, and our arrangements were made by my ministry, working closely together with the provincial and local authorities and SEARO Secretariat. However, the current pandemic and related public health restrictions have precluded the holding of the 73rd session of RC for Southeast Asia region in its traditional manner. We now look forward to hosting all of you sometime in the future for a face-to-face meeting. I thank all the member states and the Secretariat for holding this virtual regional committee session. I welcome all the distinguished delegates and partners to this virtual 73rd session of the regional committee, which will discuss substantive statutory and reporting items that are important regionally and globally. I'm sure that with support and cooperation from all of you, we will be able to transact our business and accomplish the agenda in a constructive and meaningful manner within the scheduled 2.5-day sessions over today and tomorrow. To save time, Excellencies, and all distinguished representatives, we will now first take up the election of Vice Chairperson. May I invite the distinguished representative to propose a name for the Vice Chairperson. Thank you. So, may I take this time to give the floor to Excellency Dr. Min Wei, the Honorable Union Minister for Health and Sports, Government of the Republic of the Union of Myanmar. Excellency Min Wei, please.
Honorable Deputy Prime Minister and Minister of Public Health and also Chairperson of the RC73, Mr. Anutin Chanvirakul. It is my pleasure to see you also, and also all the distinguished delegates as well as my colleague Health Minister, the WHO Director General, the WHO Regional Director, Dr. Poonam Singh, and all the distinguished delegates and specially invited guests. It is my great pleasure in proposing His Excellency Mr. Banu Bhakta Takal, Honorable Minister for Health and Population, Government of the Federal Democratic Republic of Nepal, to be the Vice Chairperson of the 73rd session of the Regional Committee for Southeast Asia. Thank you very much, Excellency. Thank you.
Thank you, Sir Excellency Min Wei. Long time no see. Miss you very much, yes. Well, the name of His Excellency, Mr. Banu Bhakta Dakal, the Honorable Minister of Health and Population, Government of Federal Democratic Republic of Nepal, has been proposed as Vice Chairperson for the 73rd session of the WHO Regional Committee for Southeast Asia by the Republic of the Union of Myanmar. Are there any observations from all member states? If not, I hereby give the floor to Her Excellency Ms. Pavitra Devi Wanirachi, the Honorable Minister of Health, Government of the Democratic Socialist Republic of Sri Lanka. Please, Excellency.
I have pleasure in seconding the proposal for His Excellency Mr. Banu Bhakta Dakal, Honorable Minister of Health and Population, Government of Federal Democratic Republic of Nepal, to be the Vice Chairperson of the 73rd session of the Regional Committee for Southeast Asia.
Well, thank you, Excellency Wanirachi. The proposal of Vice Chairperson has now been seconded. Are there any further observations, please? As there are no observations, I have the pleasure in announcing that His Excellency Mr. Banu Bhakta Dakal, the Honorable Minister of Health and Population, Government of Federal Democratic Republic of Nepal, is elected as Vice Chairperson of the 73rd session of WHO Regional Committee for Southeast Asia. My honor to work with you, sir. I congratulate His Excellency Mr. Banu Bhakta Dakal for his election as Vice President. Well, Excellencies and distinguished representatives, in view of the virtual format and reduced duration of the RC73, it was envisaged that discussions on each agenda item may not be possible. As you are aware, the high-level preparatory meeting for the 73rd session of this RC for Southeast Asia and the 13th meeting of the Subcommittee on Policy Program Development and Management were conducted virtually from 7 to 9 of July this year. Our member states in the region were well represented in these meetings at senior levels and deliberated in detail each agenda item of the 73rd session of the Regional Committee and provided their recommendations thereon. We are thankful to the work done by them in the interest of streamlining the Regional Committee's work. Here, I would like to bring to your attention that after discussions during these meetings and subsequent information sessions held with member states, it was unanimously agreed to consider special procedures to regulate the conduct of this virtual session. I invite the Secretariat to explain the special procedures. Mr. Secretariat, please.
Thank you, Excellencies and distinguished representatives. To achieve maximum efficiencies in the given time, the Secretariat, in consultation with the legal department at HQ, drafted the set special procedures. The rules of procedures and committee would continue to apply in full, except to the extent that they are inconsistent with these special procedures. According to the special procedures, the agenda items of the 73rd session of the Regional Committee are proposed to be categorized as follows. Provisional agenda item numbers 7 to 13 would be considered under so-called written silence procedure. In this respect, member states and other participants have been invited to submit written statements in advance of the original committee session, which would be appropriately reflected in the report of the original committee session. The expectation is there there would be no substantive discussions under these items during this virtual meeting. In respect to provisional agenda item number 5, key addresses and report on the work of WHO, and item number 6, ministerial roundtable on COVID-19, member states have had the opportunity, if they so wished, to submit pre-recorded video statements of no more than 7 minutes in lieu of live interventions. In addition to categorization of agenda items, the special procedures also cover attendance, addressing the regional committee, credentials, decision-making, and report of the session. The Secretariat shared the draft special procedure with all the member states for the review and prior informal agreement in advance of the session. We note that all the member states have conveyed their informal agreement on the proposed special procedures. Also, in view of the virtual format and reduced duration of the RC73, separate meeting of the resolutions drafting group for finalizing the resolutions and decisions for adoption by the original committee are not possible. Accordingly, during the HLP and SPPDM meetings and subsequent information session, the member states have also identified the subjects on which resolutions and decisions are proposed for the consideration of the 73rd session of the original committee. In addition to the special procedures, the proposed resolutions and decisions were also circulated by the Secretariat for prior agreement by member states in advance of the RC73 session. The identified and agreed resolutions and decisions will be taken up by the committee tomorrow for adoption. Thank you, Chair.
Thank you very much, Mr. Secretariat. May I now call upon the committee to first adopt the special procedures and the related decision. Any observations, please? I hope there's no observation. So as there are none, I hereby declare that the decision on the special procedure to regulate the conduct of this virtual 73rd session is now adopted. May I? On behalf of all member states and the regional committee, I would like to express my appreciation to the regional director for efficiently conducting the high-level preparatory meeting and the meeting of the subcommittee on policy and program development and management and subsequent information sessions, outcomes of which would greatly facilitate our present deliberations. Now, let us take up the agenda item 3, which is credential of representatives. I would like to report to the regional committee that in line with the just adopted special procedures, I am informed that the chairperson of the 72nd session of the regional committee, His Excellency Dr. Vardhan, the Honorable Minister of Health and Family Welfare, Science and Technology and Earth Sciences, Government of India, together with the Vice Chairperson, Her Excellency Ms. Deshan Wangmo, the Honorable Minister of Health Royal Government of Bhutan have examined the validity of the credentials of representatives, including alternate and advisors from all member states in the region. It is therefore my pleasure to report to the Regional Committee that the credentials from all member states were found to be in order. It is therefore proposed that the Regional Committee recognize the validity of the credentials presented by the member states of the region. Any observations, please? In the absence of any observations, I declare that the distinguished representatives are in agreement with the report on credentials and that the Regional Committee accepts the credentials of representatives from all member states of the region as valid. Excellencies and distinguished representatives, let me bring you to agenda item 4, which is the adoption of the agenda. May I request the Secretariat to introduce the agenda?
Excellencies and distinguished representatives, in accordance with Rule 7 of the Rules of Procedures of WHO Regional Committee for Southeast Asia, the provisional agenda of each session shall be drawn up by the Director in consultation with the Chairman. Accordingly, the draft provisional agenda was drawn and approved by the Chairperson of the 72nd session of the Regional Committee, Honorable Minister of Health and Family Welfare, Government of India. The draft provisional agenda revision 1 has been developed into following sections. Ministerial roundtable will be hosted by Honorable Minister of Public Health, Royal Thai Government on COVID-19. There will be 2 rounds of discussion. Round 1 on interventions applied to manage COVID-19 and maintain essential non-COVID health services in respective member states. And round 2 on policy perspectives on what is next in the context of COVID-19. Program budget matters will consider Program Budget Performance Assessment 2018-19, Program Budget 2020-21, Implementation. Policy and technical issues. The agenda has 2 topics of discussion on health workforce strengthening and monitoring progress on UHC and health-related SDGs. Progress report on selected regional committee resolutions will be presented as per the reporting timelines of the respective resolutions. Governing body matters includes review of draft provisional agenda of the 148th session of the WHO Executive Board, as well as elective posts. Management and government matters provides updates on WHO transformation agenda. Finally, special programs will have 2 agenda items. Honorable delegates, as has been communicated, agenda item 5 and 6 will be taken up for discussion during today and tomorrow. We will duly note your inputs through written statements on the remaining agenda items, which will be recorded in the RC report. Thank you.
Thank you, Mr. Secretariat. The provisional agenda with document reference SEA/RC73/1, revision 1, dated July 2nd, 2020, is now placed before the Regional Committee for adoption. Are there any comments on the provisional agenda? I hope there's no comment on this, and I declare that the distinguished representatives are in agreement, and the agenda is hereby adopted as per document SEA/RC73/1, revision 1, dated July 2nd, 2020. Now, before we begin our session, let me inform you that our region is one of the leaders on physical activity, and the regional director has accordingly introduced physical activity sessions. May I now request the WHO Secretariat to provide information on the physical activity sessions and make other announcements, if any.
Thank you, Chair. Excellencies, kindly be informed that keeping with the tradition since 17th session of the original committee in 2017, a mobile app has been developed and the communication to download the same was sent to all registered participants. The application is being regularly updated, and we are pleased to inform that the new feature have been introduced, which include the live streaming link, publications order form to assist you to request copies of the desired publications through the app. The Secretariat will notify the app users in advance of any announcements and any additional event feeds. During these 2 days of the original committee session, delegates will take a 3-minute breaks to refresh ourselves during the meeting under the Health for All theme. A 3-minute video will be played by the Secretariat each day for the delegates to do stretching exercise while sitting. Also, in continuation of the popular morning physical activity sessions introduced in RC69 held in Colombo in Sri Lanka, there will be a morning virtual physical activity session from 8 o'clock in the morning to 8:40 Bangkok time tomorrow. An exercise video with contributions from India, Myanmar, Thailand, and Timor-Leste will be broadcast live by the Secretariat on social media platforms, which is Facebook and YouTube. We urge all of you to join from your respective locations. Thank you.
Thank you, Secretariat. It is a great opportunity to walk the talk. And may I now request the Secretariat to lead us through the 3-minute physical activity break for today.
Thank you, Excellencies and distinguished delegates. Let us now take a break for our physical activity. Please ensure to have some space around your respective sitting areas and follow the video on the stretching exercise themed COVID-19 prevention and regional solidarity. Thank you.
New normal.
COVID-19 deadly virus, all of us share duties. Easy tips to protect, make them check for you and me. Keep distance, not too close. Check out pose, not too pack. Check out left, check out right, not too tight, front and back. Put on as when go out, cover mouth and our nose. No touching, no scratching, keep it clean, not depose. For hell of billions, strengthen you see. Prepare for emergency, protect vulnerability, sustain our success, accelerate our gains, innovate and maintain, be the change, yes we can. Left, right, left, left, right, left, left, right, left, left, right, left. Bangladesh, Bhutan, Nepal, Libya, Korea, Thailand, Indonesia, Myanmar, Maldives, India, Timor-Leste, Sri Lanka. We are Southeast Asia region. Wash our hands, wipe the germ off our hands, soap our hands, rub our hands, watering and dry our hands. Fruit and veg, food safety, eat healthy, we'll make our day. Exercise, firm and fit, keep COVID at the bay. Southeast Asia, one region, companion for COVID mission. Start with love, start with trust, start with us, we'll be as one. Sustain our success, accelerate our gains, innovate and maintain, be the change, yes we can. Bangladesh, Bhutan, Nepal, Libya, Korea, Thailand, Indonesia, Myanmar, Maldives, India, Timor-Leste, Sri Lanka. We are as one. Southeast Asia is one. We leave no one behind.
Thank you. I hope you all have enjoyed the exercise sessions. Even though it's only 3 minutes, but it surely makes us feel more comfortable than a few minutes ago. And I would like to thank you, Mr. Secretary. It is a great opportunity. I have to move to agenda item 5. So we will now cover the key addresses and the report on the work of WHO. Dear all, you will kindly observe that this agenda item has 2 sub-items. Let us first take up item 5.1, Introduction to the Regional Director's Annual Report on the work of WHO in the Southeast Asia region, covering the period between January 1st to December 31st of 2019. I invite your attention to the document SEA/RC73/2. Madam Regional Director, Dr. Poonam, and Excellencies, as today I have to attend the General Assembly at the Parliament House, so the following session will be run by our Vice Chairperson, the Honorable Minister of Health and Population, the Government of Nepal. Now, may I now invite Dr. Poonam Ketrapal Singh, the Regional Director, to present the reports, and then followed by conducting the session by the Vice Chairperson. Thank you very much.
Chair, Excellencies, distinguished guests and participants, ladies and gentlemen. It is my pleasure to introduce you to the 2019 Annual Report of the work of WHO in the Southeast Asia region. My report this year is different from previous years. It was written 6 months into a global pandemic that has deeply affected us all and is causing unprecedented damage to countries in the region. It was written at a time of continuing uncertainty. In many countries, the numbers of people infected and the numbers who have died from COVID-19 are still increasing. the number of those who have lost their livelihoods, and the size of the investments being made by governments to help mitigate the economic shock are becoming clear. Important lessons are already emerging from the response that can help guide our efforts towards recovery. Looking at what we have learned so far and anticipating future challenges and how they relate to our regional priorities are the main themes of this year's report. The other parts of the report remain, as in previous years, the country and flagship reports in parts 2 and 3, which cover the year 2019 and were prepared before the pandemic, but serve to remind us of the range of WHO's work. They also underscore the region's ongoing progress, which I take this opportunity to highlight. In 2019, the region celebrated 5 years of polio-free certification. Sri Lanka eliminated measles. Maldives and Sri Lanka eliminated mother-to-child transmission of HIV and syphilis. Bangladesh, Bhutan, Nepal, and Thailand achieved hepatitis B control. Progress on each of the region's 8 flagship priorities continued. By year-end, all countries were administering 2 doses of measles and rubella-containing vaccine and had at least 1 proficient national laboratory to support measles and rubella case-based surveillance. Bhutan, DPR Korea, Maldives, and Timor-Leste sustained their measles elimination status. Bangladesh, Bhutan, DPR Korea, Maldives, Nepal, Sri Lanka, and Timor-Leste sustained rubella control, which all countries are now striving to eliminate as per the 2023 target. On preventing and controlling non-communicable diseases, the region continued to leverage high-impact best buys. 5 of the region's member states, namely India, Nepal, Maldives, Thailand, and Timor-Leste, are now among the world's top 10 countries with the largest graphic warnings on tobacco packaging. Bangladesh, India, and Indonesia made substantial increases in tobacco taxation, while Myanmar began developing a new and comprehensive tobacco control law and policy. 7 member states are pursuing national targets on reducing exposure to household air pollution. Most member states have developed mental health policies which they have been integrating into national health priorities. The region continued to accelerate reductions in maternal, neonatal, and under 5 mortality. Almost all countries have developed a national quality improvement strategy to ensure maternal and child health services meet expectations and needs. All countries are now implementing maternal death surveillance and response, in addition to maternal perinatal death surveillance and response, which will help reduce stillbirths, a key area of focus. Commendably, the region is on track to achieve the GPW target of a 30% reduction in maternal and child mortality by 2023. The region's steady progress towards universal health coverage continued. Trend data from this year's annual progress report shows that service coverage improved throughout 2019. The quality of member state data on UHC is now stronger than before, with data on financial protection becoming a point of focus, in addition to capturing and quantifying foregone care in regular household surveys. The region continued to build national capacity to prevent and combat antimicrobial resistance. All countries in the region actively participated in World Antibiotic Awareness Week, making the Southeast Asia region the world's only region in which all countries took part. 10 of the region's 11 countries are now participating in the Global Antimicrobial Resistance Surveillance System, which is more than 2.5 times the proportion of countries taking part globally. The region continued to be the only WHO region where all member states carried out the tripartite AMR self-assessment exercise. Member states made timely progress to scale up emergency risk management. All countries reported IHR capacity using the state parties' annual reporting tool. The region's reported preparedness index rose to 61%, up from 56% in 2018. In March, the region launched its Southeast Asia Regional Knowledge Network of national IHR focal points. The innovative mechanism is designed to facilitate peer-to-peer learning and the dissemination and uptake of best practices across the region. Thailand became the first country in the region to receive WHO classification for the emergency medical team. All countries adopted the Delhi Declaration on Emergency Preparedness, reflecting the high-level importance that member states have given to this crucial area of work for many years now. The region's momentum on finishing the task of eliminating neglected tropical diseases and other diseases on the verge of elimination gathered pace. Myanmar has been validated for the elimination of trachoma. Nepal achieved this in 2018. Timor-Leste became the first country in the region to successfully implement the first round of the new triple drug IDA therapy for lymphatic filariasis countrywide and is on track to eliminate the disease by 2024. India expanded its implementation of the triple drug therapy from 4 LF endemic districts to 19. Maldives launched an ambitious yet attainable plan to achieve 100 leprosy-free islands by 2023. Maldives and Sri Lanka maintain their malaria-free status, and Bhutan and Timor-Leste are nearing elimination. The region continued to accelerate efforts to end TB. In the Global TB Report, Myanmar was identified as one of a handful of countries globally to be on track to reach the NTB 2020 milestones. The region's success across all areas of health has indeed been strong and must be recognized as such, not only because of the commitment, determination, effort, and capacity that it represents, but also because of what is at stake in the current crisis. We cannot afford that our progress is halted or reversed. We must protect and defend our many gains. In addition to documenting the region's achievements in 2019 and WHO's support to them, the annual report contains a special section that provides an overview of all of WHO's COVID-19 related activities in the region. WHO will continue to provide its steadfast support across all 9 pillars of the Strategic Preparedness and Response Plan, and wherever else requested or required. Today, I also wish to speak directly to some of the big picture issues that the annual report addresses with regard to COVID-19 and the future of public health and sustainable development in our region. It is only by candidly addressing such issues that we can mitigate them and continue to effectively respond to the pandemic while sustaining and accelerating progress on the flagship priorities, WHO's triple billion targets, and the Sustainable Development Goal 3. Chair, Excellencies, COVID-19 is first and foremost a health crisis, but its economic consequences are unprecedented. Governments and international organizations are having to respond at a scale few could have ever imagined. Some countries globally have the fiscal firepower to protect employment and livelihoods. Many do not. Governments in our region face an unprecedented and complex set of epidemiological, political, and fiscal challenges. I see a number of emerging trends. First, the choice between life or livelihoods. Lockdowns have been effective in slowing the spread of the disease, but when rigorously enforced, come at a high economic cost. In recent months, we have seen pressures to ease restrictions, supported by rhetoric that pits health against short-term economic recovery. Easing containment measures, while case numbers and death tolls are still rising, is a real and present danger. But in the long term, we do not have a choice. Life versus livelihoods is a false dichotomy. Effectively containing the virus through good public health measures and a vaccine in the future is the only long-term solution to the economic crisis. Second, the virus is exposing existing pathologies in our systems of healthcare, governance, and the economy. Where there are inequities and vulnerabilities, the virus makes them worse. While higher income countries are projected to experience the greatest decline in economic growth, lower income economies have the least resilience to shocks. This is particularly true for those countries dependent on tourism and garment production or in export subject to declining commodity prices. A particular concern for this region is dependence on remittances from migrant workers. When unemployment follows lockdown, the result is not just a precipitous loss of income, but a surge in return migration from urban to rural areas and from migrant hosting countries to home countries. This spreads the disease further and drives poverty and food insecurity in the communities to which migrants return. It also impacts on remittances, which are a major source of national income. Third, other health conditions are being exacerbated by the pandemic. Medical and surgical care that has been delayed or cancelled, suspended vaccination programs, absences of staff, and closure of facilities, fear of infection, increases in suicide and intimate partner violence, mental health crisis and drug and alcohol abuse under lockdowns, and exposure to hostile environments when lockdown and physical distancing are not possible. The poor face a stark choice, the gamble of infection against the certainty of hunger. In many places, we see discrimination and violence against healthcare workers by landlords and neighbors, which is totally unacceptable. But there is an opportunity. Health is now seen by heads of state and government as a central and crucial issue. Another positive, the devastating knock-on effects of a pandemic should mean that we never again have to argue about the links between health and the economy or the need for health care and financial protection to be universal. At a practical level, we have seen an unprecedented willingness to spend on measures to address the impact of the crisis. The challenge going forward is to direct this attention towards the longer-term resilience and sustainability of the health sector. Chair, Excellencies, responses to the crisis depend on countries individually, but full recovery depends on countries collectively. The big risk comes with fiscal contraction. Governments across the region have committed to unprecedented levels of expenditure in response to the crisis. For some, this will make their fiscal situation even more precarious. For all, a period of fiscal consolidation or contraction is likely to follow. Precedents from past crises suggest that whenever fiscal contraction has occurred, health and social spending are the first sectors to be affected. There is no guarantee that just because a health crisis precipitated the situation, that health spending will be protected. The 2008-9 financial crisis had its greatest impact in high and upper middle income countries. Emerging from the crisis, some chose to implement austerity programs to rapidly reduce budget deficits. As a result, social care and health services took a major hit. We need to think about how to avoid the same mistakes. This means identifying spending priorities that both contribute to economic recovery and growth and keep UHC on track. The Asian financial crisis in the late 1990s took place at a time when the choice for many, when they were ill, was either to forego treatment or to finance it through debt or selling precious assets. For many people in the region, this remains the case. In several countries, an expanding middle class sought to mitigate this risk through household savings. But the currency devaluations that followed the crisis meant that much of the value to these savings was lost. The consequences were serious, but the crisis created a political opportunity and a vocal constituency for social safety nets, including financial protection for health, to which governments had to respond. The countries in the region most affected by the crisis started work on different forms of social health insurance in the immediate aftermath. By contrast, in countries relatively untouched by the crisis, health policy remained fundamentally unchanged and underfunded. The key question now is how COVID-19 will change financial protection for health and how will governments respond. While overall levels of official development assistance held up in the immediate aftermath of the global financial crisis, the way in which it is provided has changed, often due to public pressures in donor countries. Flexible health sector and budget support has been replaced by tightly specified budgets linked to an externally defined results agenda. For bilateral agencies, one-off transactions to single-purpose global funds deflect risk from the donor and are increasingly attractive in the face of reductions in staff headcounts. Support to the UN system has continued to decline. We must ask ourselves, will these trends continue, or will the crisis provide an opportunity to rethink the role of external support and debt relief? As the present crisis unfolds, we are reading more and more about the new normal. But we must be realistic. We cannot assume that the pandemic will transform the world or national health systems for the better. It will require that difficult choices be made, that deliberate actions be taken, and it will take time. Above all, it will require firm, clear, and empathetic political and technical leadership and a steadfast commitment to not only sustain present health spending, but to also accelerate it. The good news is that the priorities we've already decided to pursue in this region require only limited adjustment. As this crisis unfolds, the way the health sector responds will be critical. Given the depth of economic crisis, the damage that could ensue as a result of a major contraction of health spending could result in losing many of the hard-fought gains we have achieved in the recent decades. Our first challenge, therefore, is to sustain and scale up current health spending. We must strengthen the economic and political argument for sustaining health investment as a prerequisite for recovery. The concept of universality also reminds us of the equity gaps that have been so cruelly exposed by the pandemic. Universality must include everyone: migrants, refugees, slum dwellers, those in remote areas, and all those other groups so clearly at risk of being left behind. Increasing the strength of the health workforce and enhancing access to safe and affordable medicines, vaccines, and all other forms of medical technology must continue to focus our efforts. Yes, throughout the pandemic response, but also beyond it. It is only by doing so we can continue to achieve our sustain, accelerate, innovate vision and build a healthier, more health secure and sustainable region and world moving forward. Let me end with 3 suggestions that can hasten the region's onward momentum. First, national leadership linked to local decision making. National leadership, by which I mean the readiness to act decisively and in ways that build trust and compliance, is vital. At the same time, what works for containment in one area may not be applicable elsewhere. We have seen in our region that effective national leadership not only sets the overall tone and framework for managing the pandemic, but also leaves space for local administrations to apply their experience and detailed knowledge. Second, effective communication. Leadership, trust, and the ability to communicate clearly are indispensable in any crisis, even more so when risks to life and health are at stake. Local and national responses must be owned by people and not just experts. As and when we start to roll out a COVID-19 vaccine, the ability of health personnel to communicate effectively and sensitively can make the difference between success and failure. Widespread acceptance of a new vaccine is not guaranteed. Rejection by a significant proportion of the population is a real danger. Expectations are high, but we have to explain that not all vaccines are 100% effective, that we cannot be sure how long protection will last, but that all precautions have been taken to ensure safety. We must communicate the need for priority setting. Effective engagement of communities require clarity, empathy, and attention to detail. It is a vital component of political leadership, but is equally important at all levels of the health system. Third, learning to manage uncertainty. Emerging from the pandemic will raise difficult questions about recovery that have the potential to influence all aspects of national life and international interaction. We have to prepare for a wide range of possible futures. Each country will seek its own answers to the questions they face. But health leaders must be looking ahead for early signals as to what is happening and what the consequences for people's health will be. One thing is certain. We cannot sit back and expect it will all turn out the way we want. Chair, Excellencies, together we must continue to push ever harder for a future that is not only healthier, but also more health secure. Together we must continue to drive sustained progress towards achieving health for all.
Thank you, Dr. Singh, for a very comprehensive introduction to the annual report. I would like to take this opportunity to appreciate the support of the WHO member state in the region in strengthening the national health policy as well as health system, which have resolute in improving the quality of health care service available to the people in this region. I especially recognize the purposeful leadership of Dr. Poonam Singh, the regional director, which is related in her initiative to improve public health through state as collectively agreed flagship priority programs, management reforms, and the recent COVID-19 strategic response plans. These have resulted in remarkable improvement in implementation and forward. It is an honor to have Dr. Tedros Adhanom Ghebreyesus, Director General of WHO, in virtual attendance at this meeting, and we look forward to his vision and guidance on the important matters before this committee. May I now invite the Director General, Dr. Tedros, to deliver his address.
Your Excellency, Mr. Anutin Charnvirakul, Deputy Prime Minister and Minister of Public Health, Thailand, and Chair of the Regional Committee, Honorable Ministers and Heads of Delegation, Regional Director, my sister, Dr. Poonam Ketrapal Singh, dear colleagues and friends, Sabadikap, It's a great honor to be with you again. Although I regret that for the second year in a row, I have had to join you virtually. Although virtual meetings have enabled us to continue working through the pandemic with a much lower carbon footprint than flying, I must admit that I miss the in-person interaction with all of you. I look forward to being able to see you again. Holding our meeting virtually is a small price to pay compared with the suffering of so many people around the world and in your region. Lives and livelihoods have been lost. The global economy is in recession, and social and political fault lines have been exposed. Since the beginning of the pandemic, WHO has been working to support countries in several ways at all three levels of the organization. More than 90% of countries in the SEARO region now have a national preparedness and response plan, and all countries have lab capacity for testing for COVID-19, compared with only 4 countries at the beginning of the pandemic. In addition to our technical and normative support for member states, WHO has also provided tons of PPE tests and other essential items, as Dr. Singh explained. We have had more than 570,000 enrollments from the SEARO region in WHO's online courses for COVID-19 through the openwho.org learning platform. And through the Access to COVID-19 Tools Accelerator and the COVAX Global Vaccines Facility, we're working to ensure that if and when a vaccine is proven to be safe and effective, it will be accessible equitably for all countries in your region. Of course, COVID-19 is not the only emergency to which you're responding in the region, and not the only health challenge. I'm encouraged by the progress in each member state and against each of the regional flagships reported in this year's annual report, which have been described by my sister, Dr. Poonam. Since 2000, there has been more than 70% decline in the measles mortality in the region, and significant progress against rubella. I'm delighted that Sri Lanka has joined 4 other member states as having eliminated measles, and that 6 member states sustained rubella control during the year. On non-communicable diseases, I'm delighted that Thailand became the first country in Asia to adopt plain packaging, and I encourage other countries to follow Thailand's example. Still, large gaps remain across the region in implementing many of the best buys to address the risk factors for NCDs, and I encourage countries to take this challenge very seriously. Maternal, neonatal, and under 5 mortality all continue to decline. It's very encouraging that your region is on track to achieve the 3 billion target of a 30% reduction in maternal and child mortality by 2023. Well done, and keep it up. On the crucial target of achieving universal health coverage, it's very encouraging that UHC service coverage index in the region has increased steadily from 46% in 2010 to 61% in 2019. However, more than 800 million people still lack full coverage of essential services, and about 65 million people are pushed into poverty every year because out-of-pocket health services. These are critical issues to address for all countries. On antimicrobial resistance, I'm encouraged that all member states have now enrolled in the Global Antimicrobial Resistance Surveillance System, a vital tool for monitoring the spread of AMR globally. However, there is still a shortage of national estimates, and we urge those countries who have not yet submitted data to do so. Scaling up capacity in emergency risk management is obviously a key priority for all countries, including in your region. In addition to the COVID-19 pandemic, you're also dealing with the protracted Rohingya crisis, outbreaks, floods and landslides, civil conflicts, and of course, the threat of air pollution and climate change. 8 member states have now achieved compliance with their IHR core capacities, compared with just 2 member states in 2013. However, limited investment in disaster risk reduction and emergency preparedness is a persistent problem. The pandemic has demonstrated that we neglect these systems at our peril. The region continues to lead the world in your efforts to eliminate neglected tropical diseases. I'm delighted at the progress in many countries towards eliminating NTDs continues to grow. And finally, on tuberculosis, case reporting is increasing, but so is treatment access rate, and budgetary allocations have trebled in some member states. Excellencies, dear colleagues and friends, you should be proud of all these achievements. At the same time, you're all aware of the work that remains to be done in all of these areas. Sometimes the task may seem insurmountable, but with careful planning, relentless advocacy, and unwavering commitment, every mountain can be climbed. Thank you all for your commitment. As we work together to confront this pandemic, I give you my assurance that WHO will continue to support you in every way possible to suppress transmission and save lives. Even as we respond to the pandemic, we're continuing to transform WHO to serve you better. Through our special program on primary health care, we will work with you to strengthen the foundations of health systems. Through our new division of emergency preparedness, we will support you to prevent and mitigate the impact of emergencies, as well as responding to them. Through the Office of the Chief Scientist and our Division for Data Analytics and Delivery for Impact, we will provide the evidence and tools you need to strengthen your information systems to make the best decisions for the biggest impact. And through the new WHO Academy, we will provide in-person and online training to empower health workers to accelerate advancements in medical care and practices to patients and communities. My brothers and sisters, COVID-19 is causing so much pain, sorrow, and uncertainty, but it's also giving us an opportunity. The whole world can now see what we have said for many years, that health is not an optional extra. It's an essential investment in safer, healthier, fairer, and more sustainable societies. This pandemic will end. The challenge all of us face is whether we can take the opportunity to drive the transformative changes in health we need to make progress towards the Sustainable Development Goals. Thank you all once again, and I wish you a very fruitful discussion. I thank you. Kop kun krab.
Thank you, Dr. Tedros. Excellencies, distinguished respective representative, the Director General address provide useful guidance to member state of region to further strengthen their COVID-19 pandemic response, health development efforts, as well as their planning for further collaborations with WHO. The steps being taken by WHO to conduct an independent and comprehensive evaluations of COVID-19's response are also appreciated, and we look forward to the result. Excellencies, distinguished representatives and participants, in accordance with the Rule 11 of Rule of Procedure of the WHO Regional Committee for Southeast Asia adherence to time while making interventions to desirable. I advise and urge all member states of complete their interventions within 7 minutes. I will now request the Secretariat to explain the traffic light system to against delegates to adhere to the time specified.
Thank you, Chair. Excellencies, distinguished representatives, we will be using and observing the timekeeping through traffic light system to help in efficient utilization of the time. On the same lines as seen during the World Health Assembly and the Executive Board. Please be aware that traffic light will be green for the first 5 minutes, and then it will turn amber for the last 2 minutes of your respective interventions. The traffic light will then turn red once the allocated 7 minutes are over. Given the virtual nature of the current RC session and limited time available with us, it is kindly requested that all speakers be cognizant of the traffic light system in their deliberations. Thank you, Chair.
Thanks the Secretariat. Excellencies, I now invite the Honorable Minister to make their comments. Now, I would like to invite Bangladesh, His Excellency Mr. Zahid Malik.
Person of the 73rd session of the Regional Committee, His Excellency Vice Chairperson of the 73rd session of the Regional Committee, Excellencies, Ministers of Health, Dr. Tedros Adhanom Ghebreyesus, WHO Director General, Dr. Poonam Khetrapal Singh, Regional Director, WHO, Southeast Asia region, ambassadors, representatives of the United Nations agencies, development partners, non-state actors, ladies and gentlemen. Bangladesh welcomes the Regional Director's annual report on the work of WHO in the Southeast Asian region for the period of 1st January to 31st December 2019 and the address of the Director General. As outlined in the Regional Director's report, Bangladesh continued to accelerate progress in addressing communicable disease, non-communicable disease, risk factors, mental health, digital health for universal health coverage, and international health regulations. Bangladesh rolled out the WHO package of essential non-communicable disease intervention and adopted the HEARTS technical package. To address non-communicable disease factors, the government of Bangladesh restructured tax system to address tobacco use. Recognizing its efforts to promote mental health and well-being, Bangladesh was chosen as one of the 6 countries of the world to participate in the first phase of the special initiative for mental health by the WHO Director General. Important steps have been taken to harness the potential digital health in moving ahead towards universal health coverage. A pilot project implemented in City Corporation on the electronic immunization registration to increase vaccination reports, which helped the city to reach full immunization coverage for children aged between 0 and 23 months. Bangladesh in 2019 further increased its capacity to implement IHR core capacities. The overall IHR implementation status increased from 58% in 2018 to 67% in 2019. Within this, Bangladesh has exceeded the regional and global average. The government of Bangladesh, along with WHO and partners, have been providing life-saving health services to more than 1 million people living in the forcibly displaced Myanmar nationals camps in Cox's Bazar. Ladies and gentlemen, despite of the aforementioned achievements, like other countries in the region, while shifting health system focus towards COVID-19 response, pandemic has disrupted the delivery of essential and life-saving health services in Bangladesh. COVID-19 cases in Bangladesh reached a peak in late June, early July, followed by a slight decline, and seemed to have plateaued at somewhere between 2,000 and 2,500 new cases daily and death 30 to 40 a day. To handle the pandemic, especially to avoid the death number, Bangladesh is doing all the efforts through mass mobilization of healthcare system, public employees, and the security forces, combined with energetic and creative public education campaign. In line with the WHO COVID-19 strategic preparedness and response plan, Bangladesh's preparedness and response plan for COVID-19, which proposed strategic intervention to restore and maintain essential services. As an immediate response, the government also ensured safe immunization, essential RMNCH, nutrition services, and essential services for HIV, TB, malaria, and leprosy by implementing the updated guidelines responsive to deliver essential services. Government has already resumed normal outpatient, inpatient, emergency services across all health facilities. We are to eradicate this COVID-19 virus. For that, we need an effective and affordable vaccine available to all. We are confident that WHO will arrange vaccines with priority where it is available for all countries, including Bangladesh. Therefore, with timely interventions by the government, the utilization of essential health services is gradually increasing after May 2020. The most successful story of building better was seen in EPI program. In comparison with the previous year, the coverage rate had declined by 50% during the month of March to May 2020. Nonetheless, by June 2020, the coverage had increased to 100%, with subsequent continued increase. The government of Bangladesh worked with WHO and other development partners to establish a national system for quality health services during COVID-19. The government of Bangladesh will continue its strong relationship with WHO and health development partners to address the current and future pandemic and carry out numerous key activities and develop key policies and strategic plans. Thank you, Chair. His Excellency.
Thank you, Honorable Minister Zahid Malik from Bangladesh. Now I would like to invite Bhutan, Her Excellencies Leonpo Dechen Wangmo.
Director WHO SEARO, greetings from Bhutan and Kuzuzangpo. I have the honor of conveying the warmest greetings of His Majesty the King, the Royal Government, and the people of Bhutan. On behalf of the Royal Government of Bhutan, I extend the heartiest congratulations to Thailand for hosting the 73rd WHORC in the most efficient manner during these challenging times. Distinguished delegates, the majestic stupa that you see behind me was built in the memory of our third king, His Majesty Jigme Dorji Wangchuk. who is fondly remembered as the father of modern Bhutan. Late His Majesty was instrumental in setting up the allopathic health system in the country, with the vision that every Bhutanese must always have access to quality health services. Thus, it is only appropriate that I deliver my country statement from this venue to remind us all of the critical need to invest in building better, resilient and sustainable health system for the advancement of any nation. Ladies and gentlemen, for Bhutan, the last 7 months has been a trying time for all, especially my health workers who are in the forefront of this pandemic. I would humbly like to take this opportunity to express my greatest appreciation to all the health workers around the world working tirelessly for the benefit of humanity. Thank you. Our response to the pandemic all along has been of a whole of a society approach. Every member of the society has come together with the singular goal to prevent and mitigate the impact of COVID-19. At the helm of the response is His Majesty the King, leading the fight with compassion and wisdom, ensuring that no individuals and families face any health, economic, social hardship due to COVID-19 pandemic. Recognizing that the impact of the pandemic is beyond health, His Majesty the King instituted the Druk Gyalpo Kidu Relief Fund on the 14th of April to provide income support to the affected individuals. The Relief Kidu till date has provided immediate relief to over 23,000 plus individuals and families who have lost their livelihood, either partly or completely because of COVID-19 pandemic. Bhutan's preparedness and response plan of COVID-19 began as early as January, with surveillance at the point of entry implemented on the 15th of January, and a week later, the Health Emergency Management Committee was activated. As I speak, there are 227 confirmed cases with 85 active cases and 0 deaths till date. Since the start of the 21-day mandatory quarantine on the March 23rd, a total of 12,000 plus individuals were quarantined in designated quarantine facilities, which are fully funded by the royal government. An integrated surveillance system along with 54 flu clinics and 3 additional regional laboratories across the country was established in April to ensure efficient implementation of our 3T strategy: aggressive testing, efficient tracing, and early treatment. A total of 100,000 plus tests were conducted with an estimated of 13,700 tests per 100,000 population. Upon the command of His Majesty, the Royal Government of Bhutan started the repatriation flights of Bhutanese living abroad, and as of today, a total of 8,000 plus Bhutanese returned home from 11 countries and 8 major cities in India. Distinguished delegates, we welcome the Regional Director's annual report and commend the progress and achievement of WHO's work in Southeast Asia region under Dr. Poonam Singh's leadership. I am pleased to inform that Bhutan has made significant progress with regard to the regional commitment and resolutions. Bhutan's commitment to eliminate cervical cancer in Bhutan is gaining headway, with an endorsement of introduction of HPV vaccine for boys by the government. Being the first country in the region to introduce HPV vaccine for young girls, we are happy to report that even during the pandemic, we have managed to achieve an overall coverage of 95%. This year, coinciding with the 40th birth anniversary of our beloved King, Bhutan initiated the Health In and Health for All, an overarching program to enhance access to people-centric quality health services and also to enhance health governance through cross-sectoral collaboration. The biggest milestone has been the amendment of the tax policy of Bhutan, which now mandates levying a 20% access equalization tax on unhealthy commodities and a 100% tax on alcohol and tobacco products. On a similar line, Bhutan is also implementing a health flagship, a program to address the increasing trends of non-communicable diseases and to enhance access to secondary health services. Through the health flagship, we hope and aspire to screen every household in the country for non-communicable diseases. As a champion for prevention of non-communicable diseases, the Honorable Prime Minister is also leading a Healthy Drukgyal, Bhutan, campaign to promote healthy diet and lifestyle. Distinguished delegates, ladies and gentlemen, Bhutan continues to sustain high MMR vaccination coverage of 97%. In addition, recognizing the human capital development as a crucial element of socio-economic progress, Her Majesty the Queen Chitsan Pema Wangchuk pioneered a noble initiative to provide integrated mother and child health services under the same roof. The 150-bedded Gelson Chitsan Pema Mother and Child Hospital started in Bhutan, which has significantly improved uptake of maternal and health care services in the country. Going forward, another 100-bedded mother and child hospital has been planned under Her Majesty's patronage for the eastern part of the country to enhance MCH services. As a mother myself, I am happy to share that the Royal Government has recently endorsed an exclusive policy to accelerate mother and child health in the country. Ladies and gentlemen, Bhutan appreciates the innovative approach of WHO and Gavi for ensuring fair and equitable access to COVID-19 vaccine. Through the COVAX facility, the leadership of WHO under Dr. Tedros has been instrumental in bringing global solidarity in the fight against COVID-19 pandemic. I and my delegation would like to extend our support and cooperation for successful deliberation with sincere prayers for good health and happiness. We are confident that our solidarity and concerted effort will enable us all to attain the collective aspiration and take us swiftly through these difficult times. Tashidele, and thank you.
Thank you, Her Excellency Leonpo Dechen Wangmo. Now, I would like to invite India, His Excellency Dr. Harsha Vardhan.
Miracle, Deputy Prime Minister and Minister of Health, Thailand, Excellencies, Ministers of Health from Member States of WHO, Southeast Asia region, WHO Director General Dr. Tedros, Regional Director WHO Dr. Poonam Khetrapal Singh, distinguished representatives, ambassadors, representatives of United Nations agencies, development partners, ladies and gentlemen, greetings from India. Last year, I had the pleasure of hosting most of you in New Delhi for the same conference of regional health ministers, coordinated by our gracious Regional Director, Dr. Poonam Khetrapal Singh. Allow me to begin this meeting by congratulating all of you, the member states of the WHO Southeast Asia region, for your extraordinary efforts to protect and improve the lives of your citizens, particularly towards the management of COVID-19 pandemic. The COVID-19 pandemic has underscored the fact that the world is a global village where all lives are intertwined, and to win, we must collaborate and fight as one. The pandemic has also taught us how important it is to protect our precious health gains. And in order to protect our health gains, we must continuously invest in health. Our region needs to invest more and more in public health care and build a robust health delivery system in all aspects, including infrastructure and human resources, with a special focus on rural areas. Excellencies, WHO was founded on the principle that each global citizen must enjoy the highest standard of health, regardless of race, religion, political belief, economic or social condition. This principle continues to guide our work even today. So far, the public health achievements made in the region have been laying the foundation of a bright future for our people. However, COVID-19 has turned the clock back years, if not decades, in the fight against infectious diseases. Data suggests that COVID-19 has already derailed a lot of our efforts and is taking us back to where we were 20 years ago. This is a stark reality, and we need to take cognizance. On our part, we left no stones unturned to contain and mitigate the virus. I would say that India has responded well to the challenges posed by COVID-19, guided by our Honorable Prime Minister, Mr. Narendra Modi. We have been doing our best and shall continue to do so. We believe in delivering results in line with the Sustainable Development Goals laid down, as well as the regional flagship programs defined for us. On each of them, we have strategized to deliver as per the guidelines and targets. India's commitment to sustain its health goals is reflected in the National Health Policy 2017, which aims to provide affordable health care for all citizens of India. We launched our most ambitious health program called Ayushman Bharat in 2018, marking a significant milestone on the road towards universal health coverage. Ayushman Bharat is also the world's largest government-sponsored free healthcare insurance program. It rests on twin pillars: the creation of 150,000 health and wellness centers to deliver comprehensive primary health care, and the other component called the Pradhan Mantri Jan Arogya Yojana, PMJ, for secondary and tertiary care to 100 million families covering 500 million individuals. Work is in full swing to make this scheme a super success that the world may emulate. There have been many other significant achievements like the elimination of poliomyelitis, maternal and neonatal tetanus and yaws, as well as considerable reductions in maternal and newborn mortality. There are many other missions that we have launched full throttle, the most ambitious amongst these being the elimination of tuberculosis by 2025, 5 years ahead of the global target of elimination. We are equally committed to our missions dedicated to eliminate neglected tropical diseases like lymphatic filariasis and Kala Azar, which are big public health problems. The National Health Mission, India's flagship health systems reform program, has facilitated the implementation of enabling interventions and a special focus on marginalized and vulnerable populations across several sectors, including communicable and non-communicable diseases. We are working aggressively with states and union territories to prevent and control non-communicable diseases. Our government understands the plight of the poor man. In line with our pro-poor policies, we have launched low-cost medicine stores called Jan Aushadhi Kendras, which provide quality, affordable, essential medicines to people in need. The future of our children is our biggest motivation and guiding force. I am proud to share that India's Mission Indradhanush has managed to reach out to over 37.6 million children and 9.46 million pregnant women across the country with life-saving vaccines. Effective program implementation is guided by sound policies. The enactment of comprehensive legislation to prohibit electronic nicotine delivery systems or ENDS and the landmark Motor Vehicle Amendment Act 2019 are just a few of the many policy initiatives aimed at saving lives of our people. I must also highlight that the need to innovate across all these programs and Southeast Asian regional flagships have been central to our work, even in the response to COVID-19. Innovations in digital technologies are sharpening the focus of our actions. On 15th of August 2020, our Honorable Prime Minister announced the launch of the National Digital Health Mission, which envisages the creation of a digital health ecosystem to enable Indian citizens to have unique health IDs, digitalized health records, as well as a registry of doctors and health facilities to ensure seamless delivery of health services across the country. Excellencies, health is multi-sectoral. Therefore, it demands linkages to solutions, resources and interventions to deliver tangible benefits. The Swachh Bharat Clean India Mission, Housing for All by 2022, Nutrition Mission, Skill Development, Smart Cities, Eat Right India, Fit India, and many such multi-sectoral initiatives have been launched, which are bringing us dividends in terms of elevating the quality of life of our people. Similarly, our National Disaster Management Plan is helping us adopt a holistic, proactive, and technology-driven strategy for all hazards. Excellencies, I would like to conclude by saying that investing in health is the biggest and the most important investment that a nation can make for its people. Fortunately, all of us who have gathered here today are in a position to influence and drive more investment into healthcare. We say that the COVID-19 pandemic has taken the world by surprise. The question is whether we have learnt our lesson. Let us be mindful of our earth, and it will be kind to us. There is no rainbow without rain. Remember that. I thank you all for allowing me the privilege to address this prestigious forum.
Thank you, His Excellency Dr. Vardhan. Now I would like to invite Indonesia, His Excellency Lieutenant General Retired Eravan Agus Putranoto.
Chairperson, Director General of WHO, Regional Director of SEARO, Excellency Minister of Health, distinguished delegates, ladies and gentlemen. Good morning. At the outset, allow me on behalf of the Government of Indonesia to express my sincere gratitude and highest appreciation to the Regional Director of SEARO and the Government of Thailand for organizing this virtual 73rd SEARO Regional Committee meeting. In this juncture, I would like to extend my delegation thanks to Dr. Poonam for the comprehensive report and Dr. Tedros for his remark. We note and appreciated the WHO SEARO rules in assisting its member state in achieving their accomplishment in 2019, namely measles elimination in the Sri Lanka, mother-to-child transmission of HIV and syphilis elimination in Maldives, and hepatitis B control in Bangladesh, Bhutan, Nepal, and Thailand. In 2019, many have been achieved across the region, and WHO support and assistance from all levels, global, regional, and country office, have been real and significant. However, 2019 has also left us with homework to be done, issues to be solved, and challenges to be addressed. This is particularly crucial considering that our collective work toward achieving the ambitious triple billion target, universal health coverage, and sustainable development goal will be definitely disrupted by the current pandemic if we do not come up with a more creative out-of-the-box solution. To achieve the triple billion target, universal health coverage, and SDGs Goal 3, we will need to further continue strengthening the capacity of health system now and in the future. While we as country committed to maximizing our effort to contribute to the achievement of the global target and support WHO in ensuring accountability, we would like to see the dynamicity of WHO and for WHO to use its resources where it can most make a catalytic difference. We need the WHO to expand its leadership role and to fulfill its mandate as the custodian of health worldwide. Distinguished delegate, in this session, Indonesia would like to highlight some of our effort in supporting the above-mentioned global target. With regards to the human resources for health in 2019, Indonesia has pursued its removal from the 57 countries, which listed as one of the countries with its RH shortage in 2006 through the expert advisory group meeting to review the relevance and effectiveness of the WHO Global Code of Practice on the international recruitment of health personnel. This effort has been also supported by Indonesia's effort in increasing the number of high-quality essential HRH, as well as improving the retention of HRH in rural and hard-to-reach area through multiple and widespread intervention. In 2019, Indonesia, together with Australia, with the support from the SEARO member state, have proposed the resolution Integrated People-Centered Eye Care, in which has been adopted through the silent procedure. The resolution aims to put vision and eye care at the center toward achieving the Sustainable Development Goals. Therefore, we would like to sincerely thanks to WHO and all member states for their support and contribution throughout the process. I thank you.
Thank you, His Excellency Lieutenant General Retired Eraban Agas Putranatu. Now, I would like to invite Myanmar, His Excellency Dr. Mint Wei.
Delegates from the member countries and the WHO Regional Director, Dr. Poonam Chakraborty, I would like to give some comments on the RD's annual report on the work of WHO in the Southeast Asia region covering the period 1st January to 31st December 2019. First of all, I would like to congratulate the staff of the WHO Regional Office as well as the country office staff for giving support to promote public health in our countries as well as in the region. I would like to mention that the lessons learned, the challenges that we have faced, as mentioned in the RD's annual report, need to be considered when we are developing future's biennial work plan. That is very important for our region. I would like to urge the member states also to carefully review the report, to take appropriate consideration to make the WHO support much more effective, targeted, and direct. This is very important for our region in terms of making the WHO funding much more effective and efficient. And I would also like to request the member state to give suggestions and ideas as to how the WHO SEARO should move ahead in terms of making the WHO support felt by the countries in terms of having great benefits to our member states. I would also like to suggest the WHO SEARO to review the last three by RD's annual report to see how we are doing. Are there any room for improvement? Are there any challenges that need to be overcome so that the WHO can effectively and efficiently allocate the budgets to our member countries? And also we need to suggest the WHO to work very closely with the regional organizations such as WHO, with UNICEF, UNFPA, and TAVI, Global Fund, and development partners, etc. This is very important for us, so all the regional organizations will be supporting the member state in a well-coordinated manner. That is extremely important because I do not want to have any duplication of efforts of the support given by UN agencies and development partners. In point of fact, I would like the WHO support to be very compact and targeted in line with each specific country needs. Because each country are getting support from many regional organizations, development partners, etc., etc. So I would like the WHO money to be effectively and efficiently used to serve as a catalyst in order to promote public health in the region as a whole. Thank you very much.
Thank you, His Excellency Dr. Mint Wei. Now, I would like to invite Nepal.
Honorable Chair, Honorable fellow ministers, His Excellency Director General, distinguished Regional Director, distinguished delegates, ladies and gentlemen. First of all, I would like to congratulate Regional Director and her team for all the hard work they did during these difficult times. Nepal has regularly received technical guidance and necessary support during this period, which is commendable. Honorable Chair, in 2019, Nepal achieved hepatitis B control target along with 3 other member states of the region. Likewise, Nepal conducted TB prevalence survey, which provided the updated and critical information to shape our in-TB strategies and plans. Based on this survey, the government of of Nepal is developing new strategic plan for the tuberculosis program. Moreover, activities to strengthen emergency preparedness paid off to better respond COVID-19 pandemic. Besides, we have maintained other public health targets which were achieved in the past, including polio eradication, rubella control, and trachoma control. These are few examples among many more which we achieved in collaboration with WHO. Despite the fact that we have been significantly strengthening the capacity for testing, isolation, contact tracing, and supplies, the growing number of infected people require more actions and resources to control the spread of disease, particularly in highly populated major cities. Many lessons learned from earthquake and subsequent other small-scale emergencies have enabled us to better strengthen our core capacities for preparedness and response of public health emergencies, which includes the establishment of health emergency operation centers, formation of emergency medical deployment teams, expansion of hospital networks. Although this pandemic is different from other emergencies, but these basic arrangements have helped us to build on existing mechanisms faster and execute quickly. Although health services were disrupted to some extent, Nepal has made many efforts to continue essential health services and prioritize public health programs. From the very beginning of lockdown, we ensured all the health facilities remained open to deliver public health services. However, limited movement during the lockdown might have restricted easy access, as evident in different assessments and monitoring from regular reporting. Despite of many barriers and obstacles, Nepal was able to conduct a nationwide measles and rubella campaign and oral polio vaccine in selected 19 districts, which demonstrates commitments of all levels of governments, health workers, and stakeholders. I would like to express my sincere thanks to WHO, UNICEF, and Gavi for their generous support in this process. As this region plays vital role in supplying vaccine and other generic drugs, we look forward to seeing the member states and health communities scale up efforts to bring solutions for vaccine and other technologies as well, so that this pandemic could be curbed quickly. Let us continue our regional solidarity and take it to the new heights, so that we could set an excellent example for the world while battling this pandemic. As this region is quite rich in the Ayurveda and other alternate form of medicines, we need to explore potential options and avenues to work together for this disease. In this area, proper research and documentation would be beneficial, where this region can play a vital role. Honorable Chair, the annual report presented by the Regional Director highlights many successes and challenges in the region. On behalf of the Nepali delegation and on my own, I would like to express our sincere thanks to Regional Office for all the hard work for preparing this report. The Nepali delegation endorses this annual report, and we look forward to working together with Regional Director and her team to address specific challenges outlined in this report. Thank you very much. Namaste.
Now I would like to invite Sri Lanka, His Excellency Miss Pavitra Wanni Arachi.
Ayubowan. Warm greetings from Sri Lanka. Your Excellencies, Regional Director Dr. Poonam and distinguished participants. The annual report of our Regional Director is noted and appreciated. The report truly reflects the pivotal role played by the Regional Director in giving leadership to Southeast Asian countries and in strengthening our own emergency response. The regional flagship activity has played a critical role in the hour of need and has helped us in reaching better outcomes in responding to COVID-19 too. Thank you for highlighting in the summary on Sri Lankan performance the achievements for reduction in child mortality, preventing mother-to-child transmission of HIV, elimination of measles, maintaining the elimination status of malaria, intervention on NCD by the introduction of the traffic light system into food and beverages, among others. The Essential Health Service Package launched last year will further strengthen our efforts in universal health coverage. At this inaugural session, I would also like to share the experiences of some important decisions taken by the government of Sri Lanka in the transition to the new normal whilst relating action taken on regional flagship areas. In Sri Lanka, decisions on the COVID-19 response were taken adopting a whole government approach as a matter of national security, and a national task force was set up. The country went into an extended period of lockdown with an island-wide curfew being imposed and inter-district travel being curtailed over an extended period of nearly 2 months, while all public activities except for very essential services came to a standstill. With the leadership of His Excellency Gotabaya Rajapaksa, the high-level government commitment for prompt action at a very early stage in the pandemic continues up to now. With the security forces join hands with frontline public health teams and public acceptance of this way of work at the time of restrictions, I would say we were successful as we were able to keep the clusters to a manageable number and prevent community transmission outside these clusters. A technical task team was appointed by my ministry to prepare instruction on how relaxation should take place. As a result, a roadmap for this was presented by the team in the form of an advocacy brief. Our government endorsed this brief, which is available on our website. As public activities comprised of a large variety of functions and work settings that have different level of risk, the timeline which was presented through the advocacy brief, became a tool for further decisions and discussions, and the public too followed the cabinet-approved timeline. The economic revival in our country, just as in many of the Southeast Asian region countries, will depend on tourism, labor migration, and export-driven industries, which have all suffered. I take this opportunity to request the support of the Regional Director for regional technical support in creating a better understanding through regional discussion on how our economies can open up through making international travel safer. A further challenge that I would mention has relevance to the aggressive and very successful risks communication that we did at the beginning of the COVID-19 pandemic outbreak. This also caused different health-seeking behaviors among people. It would be time to assess how universal health coverage is affected and the lessons learned when managing future emergencies and pandemic situations. I would like to stop here as I am able to share further experience at the ministerial roundtable discussions tomorrow. Once again, I thank you for the report. Thank you, Chairperson.
Invite Democratic People's Republic of Korea, His Excellency Choi Wee-kul.
Honorable Director General of the World Health Organization, Regional Director of the WHO Southeast Asia region, ministers and heads of delegations. First of all, I'd like to extend my deep thanks to the Ministry of Public Health of the Kingdom of Thailand and the Secretariat of the Regional Committee for their great efforts for the successful holding of this session in spite of the enormous challenges encountered due to the pandemic. I would also like to extend my warm greetings to the tens of thousands of public health workers in the region who are entirely devoting themselves even at this very moment to saving the lives of the people. Not only our region, but also the whole world are now waging a war against the invisible COVID-19. The current global pandemic gives us serious experiences and lessons. It alerts all of us to the critical mission and role of WHO and the governments and health workers of all countries, and to the ways on how to respond to the global pandemic at a governmental, regional, and global level. At the onset of COVID-19, Chairman Kim Jong-un of the State Affairs Commission of the Democratic People's Republic of Korea established the Emergency Anti-Epidemic System, and during the month of August alone, personally presided over 3 meetings of Central Committee of the Workers' Party of Korea with respect to the ongoing global pandemic in order to discuss and make decisions on further strictly enforcing the state emergency anti-epidemic system and perfecting an integral anti-epidemic control system for protecting the life and safety of the people, and ensure that the anti-epidemic activities be shifted into an undertaking of the government as a whole and all people. Therefore, although the whole world is now being blanketed with COVID-19, our country is keeping the record of 0 COVID-19 case. The government of the DPRK that regards people's safety as the highest national priority has systematically increased investment in the health area. And tangible progress is being made in stepping up the work for strengthening material and technical foundation of the public health sector, thus increasing self-reliance capacity. With the government investment, Ryugyong General Ophthalmic Hospital Ongyu Children's Hospital, Yugyong Dental Hospital, and Breast Tumor Research Institute under the Pyongyang Maternity Hospital have been set up in recent years along modern lines. And the Pyongyang General Hospital is currently under construction as an up-to-date and comprehensive health facility designed for further promoting the people's health. Chairman Kim Jong-un of the State Affairs Commission of the DPRK personally took part in the groundbreaking ceremony of the Pyongyang General Hospital in March this year. In the ceremony, he said that though a number of public health facilities have been built in recent years, we should have a viewpoint in mind that we start everything from scratch and thus develop our public health service into a people-oriented one and most advanced one in the world. Once a modern and smart Pyongyang General Hospital is built, the benefits of the most popular and universal free medical care system, which has a history of 70 years, and the level of our civilization will further be upgraded. The government of the PRK is renovating and updating all the local hospitals to be modeled after the recently built Samjeon City People's Hospital, and supporting the local hospitals to have access to the telemedicine system so that they could diagnose and treat any patients by themselves. The government of DPRK also takes the technical personnel and the medical science and technology as a major motive force of public health development, and while looking far into the future, is improving the quality of education for training health workers in central and local medical education institutions. The government of the DPRK highly appreciates WHO for leading the present-day fight against the global pandemic and extends its unreserved support and encouragement to WHO. WHO, as a UN agency responsible for global health, should play a pivotal role in overcoming the current crisis. The Southeast Asia Regional Office should tide over the hardships and difficulties in providing assistance to member states, support the member states of the region to improve their capacity for responding to any health emergencies, and strengthen their collaboration among member states. The government of the DPRK, which regards the People First policy as its noble political idea, shall fulfill its duty as a head of family responsible of people's health under any circumstances, favorable or otherwise, and makes its due contributions to the world public health. Thank you.
Thank you, His Excellency Choi Wee Kol. Now I would like to invite Maldives, Miss Oisot Samia.
Maldives appreciates the very comprehensive report by the regional director and wishes to thank RD and the regional office for diligently summing up and providing an easy-to-follow snapshot of the previous year's activities, both in the region and within countries. Maldives also wishes to congratulate the regional director and her teams at the WHO regional and country offices for the innumerable achievements that we as a region has been able to accomplish under the guidance and leadership of the regional director. You have not only spearheaded the regional flagships and steered these initiatives towards changeable progress, but also have lent your time and energy at a very personal level to ensure that country priority programs and initiatives are also on track and have facilitated much needed support to member states despite the mounting challenges of the time. Mr. Chair, ladies and gentlemen, as we note in the regional director's report, Maldives by end of last year has had many success stories in the health arena, from EMTCT of HIV and syphilis, to the launching of framework of zero leprosy, to the 90% of graphic health warning on tobacco products, to launching of nursing new campaign, to the introduction of HPV vaccine to girls, to becoming the first country in the region to launch Breathe Life, All of these initiatives and successes have come as a result of continuous efforts from years past, steady policies over long term, and specially guided and well informed by WHO policy frameworks and guidelines. The technical prowess of WHO has always been the hallmark of its success and that of its member states. Maldives ushered in a new government at the end of 2018, and despite 2019 being the first effective year of the new government, we have been able to align then ongoing WHO-guided health priorities with the government's manifesto and to the 5-year strategic action plan without much modification. This, ladies and gentlemen, we believe was possible largely because these country-specific initiatives have been well guided by WHO based on sound technical justifications. Maldives looks forward to the continued guidance from you, Madam RD, as well as from your officers. Mr. Chair, ladies and gentlemen, Maldives ended 2019 upbeat and with renewed commitments for upholding the regional flagships as well as the country priorities. At the close of the year, we had our first ever National Conference on Public Health in line with the government's declaration that 2020 would be the year of public health in the Maldives. The National Conference culminated in a roadmap for achieving the objectives of the Year of Public Health. Ironically, the new year 2020 began with COVID-19, the greatest public health challenge over the past century. 2019 declaration had become all too real. Similar to other countries in the region, Maldives has been engaged in the response to the COVID pandemic for the major part of the year, managing COVID response while maintaining non-COVID services and programs have proven a challenge. We are learning and adapting as we go. I am sure that we have a lot to learn from the experiences of other countries in the region as well. Together, I am confident that we will not only overcome this pandemic, but that as a region would have valuable lessons from the pandemic that we can use to improve the health of our people. Maldives once again thanks RD and her team for the detailed report and the continued support. We look forward to continue working with other countries and remain committed to achieving both regional and country targets that we have set upon ourselves. Thank you.
Thank you, Ms. Aishat Samia. Now I would like to invite Timor-Leste, Dr. Odette D. Silva Higos.
Honorable Chair, Excellencies, Dr. Tedros, Director General of WHO, Dr. Poonam Katrapal Singh, Regional Director, WHO Southeast Asia Region, Vice Chair of 73rd Session of WHO Regional Committee for Southeast Asia, distinguished delegates, ladies and gentlemen, Timor-Leste delegation, appreciate the progress made over the past years, and especially in 2019 in the WHO programmatic areas at the global, regional, and country levels. I find it encouraging and inspiring for us as member states of Southeast Asia region to put further concerted efforts to improve health and well-being in our countries and collectively in our region. The regional flagship priorities identified for Southeast Asia region in consultation with the member states have provided further focus for the work of regional and country office for 2018-2019 biennium. The 8 flagship priorities are aligned with the National Health Sector Strategy 2011-2030 and Program of 8 Constitutional Government. The Ministry of Health Timor-Leste has worked closely with the WHO country office to identify priority activities within the flagship areas. The WHO country office has supported the Ministry of Health Timor-Leste in launching of new initiatives and strengthening old ones. Honorable Chair, Excellencies, ladies and gentlemen, 2020 has been an unprecedented and a difficult year. I would like to express my deep gratitude for the support we have received from the World Health Organization in strengthening our COVID-19 response. The technical and logistical support from the country office and the regional office, including the supply of our first batch of PPE and test kits, have been crucial for a rapid and comprehensive response. The Ministry of Health appreciates the continuous support from Dr. Poonam Ketrapal Singh, Regional Director, WHO Southeast Asia Region, and WHO Country Office, Timor-Leste. We pledge to work in solidarity with the international community and are encouraged by the intense collaboration to develop effective vaccines, medicines, and technologies. We appeal to other member states to treat this as a public good and ensure their equitable distribution. COVID-19 has emphasized the need for a strong and resilient health system focused on primary health care as the best response to this and future pandemic. While Timor-Leste is firmly committed to providing universal health care to all its people, we are aware of the significant amount of work that remains to be done to build strong and resilient health system. This remains our foremost priority. Addressing new and emerging diseases, prevention and control of communicable and non-communicable diseases, and improving service for maternal and child remain important priorities for Timor-Leste. We also need to improve our service delivery framework, quality of care, and strengthen clinical and referral care to meet the challenges and realities of today. Honorable Chair, we have recently reactivated the Saudi na Familia program, a national program which delivers a comprehensive service package for primary health care to households through domiciliary visit conducted by medical teams. We believe that Saudi na Familia is an illustration of Timor-Leste's commitment to fulfill the right to free universal health care of its people through a decentralized public healthcare system as enshrined in the Constitution. In conclusion, the delegation from Timor-Leste reaffirmed our continued commitment to the national, regional, and global health targets. We look forward to continue collaboration with member states in the region. We call for continued technical and programmatic support from WHO to accelerate our progress towards universal health coverage. I thank you.
Dr. Odette de Silva Gigos. Now I would like to invite Thailand, His Excellency Mr. Anutin Saranavirakul.
Madam Director, Excellencies, first of all, I would like to express my highest appreciation to the RD report that focused on universal health coverage in spite of COVID-19 crisis. This reflects her deep understanding and firm belief that the 3 triple billions goals, which include USC, health security, and healthy life, are interrelated. Your leadership and efforts in strengthening the health systems and USC has become the great regional force in the response to COVID-19. We appreciate the prompt actions by the regional office in providing technical support to member states. We agree that technical and political leadership are very important for this crisis. From the Thai experience, we would also add the social and community leadership. Then we combine the power of wisdom, policy, and social power into one extremely powerful triangle that can tackle any difficult challenge. The COVID-19 crisis taught us how important the social power is. Excellencies, while fighting the pandemic, we also take it as opportunity to improve overall health services. Social innovations like telemedicine and telepharmacy allow people suffering from such diseases to get better, or at least continue the same quality services. They also allow the possibility for social distancing at the hospital. This reflects well the social innovations as part of the flagship priority programs, particularly flagship 4. Universal health coverage focusing on human resources for health and access to medicine, and flagship 6 capacity in emergency risk management. Thailand has been fortunate that our health system pioneers have built up. Since 4 decades ago, the community-based health system by establishing the ground-level cadre of health workforce, the so-called village health volunteers. More than 1 million of them have become the frontline heroes during the COVID-19 pandemic. COVID-19 is a real good demonstration of the social determinant of health and the interconnectedness of all the 17 SDGs, as well as multi-sectoral collaboration. All sectors, public and private, are more than eager and ready to work in collaboration with each other, including with the health sectors. This is really unprecedented. While we are fighting with our common enemies, COVID-19, we see that it brings so many social innovations and solidarity into real and wide practices. My dear Madam, we are excited to hear the successful outcomes in 2019 under your leadership. Our regional priorities from now on need to focus more to strengthening the health systems and preparedness for the future pandemic and public health emergencies. We need our regional efforts and under your strong leadership to lay this strong foundation for our people and the future generation. Thank you.
Thank you, His Excellency Mr. Anutin Sanara Birakul. Excellencies, thank you very much for these valuable insights. I am sure all of us will learn from each other's initiative and experience in further improving healthcare delivery. Thank you all for the successful conduct of day 1 of the 73rd session of WHO Regional Committee for Southeast Asia. Distinguished representative, starting from 2014, we have decided to include the ministerial roundtable as part of the regional committee. The agenda for tomorrow's sessions includes 1. Ministerial roundtable on COVID-19, which will start at 11 hours Bangkok, Thailand time. 2. Following the ministerial roundtable, there will be 2 side events. 1. Acknowledgement to the public health achievement in the region, and B. Video launch of the WHO publication. After that, we will discuss the Secretariat proposal for the elective post for governing body meeting under agenda item 10.2. This will be followed by the adoption of the resolution 8, decision by committee, and finally conclusion of the session. That brings us to the close of our session today. Would the Secretariat wish to make any announcement?
Excellencies and distinguished representatives, as mentioned previously, kindly take advantage of the morning physical activity session tomorrow. That will start 8 o'clock in the morning Thailand time. An exercise video with contributions from India, Myanmar, Thailand, and Timor-Leste will be broadcast live. And it will be on Facebook and YouTube. Please join the session, as promoting physical activity has been a very high priority for all of us. As indicated by the chair already, we will start the session tomorrow morning, 11 a.m. Bangkok time. Thank you.
Adjourn till. Thank you. The meeting is now adjourned till we meet for the ministerial roundtable tomorrow at 11 a.m. Thailand time. Thank you. Toilet